So Emily, can you talk us through a bit more about how we might do some exercises to relax our pelvic floor or calm our pelvic floor down?
Absolutely. So pelvic floor relaxation exercises are a really important component to help manage any chronic pelvic pain condition. So conditions such as endometriosis, adenomyosis, dyspareunia, which is sexual pain, vaginismus, which is sort of overactive pelvic floor muscles, bladder pain syndrome, pudendal neuralgia, and many other painful chronic conditions in the pelvis. So essentially, we want to imagine where the pelvic floor muscles are. So I'll just grab the model. So their muscles are like a bowl, and they sit like a bowl in the bottom of the pelvis. So just kind of visualising where those muscles are can help, so that we can then try to relax them. So to relax the muscle, first of all, we need to squeeze it. So we're just going to practice squeezing our pelvic floor muscles now. So breathing in, and as we exhale, we're going to just imagine that we're stopping ourselves from breaking wind and leaking urine. So we're just engaging through the back to the front and lifting, and then releasing back down. Now I'd like you to imagine that you're in a lift. So when your muscles are in the kind of down position, the lift is at the ground floor. As we squeeze the muscles up towards the belly button, we're moving up to the first floor. We're then going to release those muscles back down to the ground floor. And then we're going to try to release these muscles a bit further down to the basement. Okay, so we're going to try now to go from ground floor to basement. Now, we need to think about our breathing for this. So if we're taking some nice diaphragmatic breaths, we'll be moving our diaphragm up and down, and that will just help with the pressure and to move those muscles downwards. So we're going to try and take 10 nice deep breaths in and out. So breathing in right to the bottom back of the rib cage, and then exhaling. So we're taking those nice deep breaths. You can watch the video on diaphragmatic breathing for some more information on how to take the breaths. But taking those nice deep breaths in and out, and just drawing the focus down to your pelvic floor muscles. So imagine they're just sinking down. So with every breath in, you're breathing right into the pelvis and stretching those muscles downwards. Releasing them downwards. You can also imagine that you're opening up like a flower underneath, or your pelvis is like chocolate and it's melting down into the bed. And you're just really trying to release and relax through those muscles. When you feel they're relaxed, you can try and do another squeeze. You can squeeze up to the first floor, and then release down to the ground floor. And then use those breaths now just to get that deeper level of relaxation down to the basement. So roughly 10 deep breaths in and out to release down. And then you could do another squeeze, and then release down again. And if you do a couple of breath cycles for a couple of minutes, a couple of times a day, that will just get your muscles used to releasing and relaxing down.
And can we do that in different positions?
Yes, absolutely. So there are some muscles around the hips that are also connected into the pelvic floor. So those muscles often get quite tight as well. So doing them in positions that stretch your hips can be really effective. And actually just doing some of these hip stretches in general without focusing on the pelvic floor can be effective too. And we're going to demonstrate some of these stretches now. We're going to demonstrate the happy baby pose. So breathing out into the stretch and holding it for 20 to 30 seconds at a time. Followed by the frog pose. And if balance is an issue, you can lean on the side of the sofa or a chair to help support you. The lower you go down into the stretch, the more you should feel it. But again, just do what's right for you. And lastly, the child's pose. So those stretches are just opening out the hips and helping to stretch and release out through the pelvic floor muscles.